Body Manual. My name is Annabelle, and today I'll be talking about the hip external rotators. So those muscles are the muscles that do this to the hip, where it turns the femur bone outwards. There are also other muscles that do that, including the gluteus maximus, medius, and minimus, as well as the sartorius muscle because of its attachment. But today I'll be talking about mainly the main muscles that rotate the hip outwards or externally rotate the hip. So the names of those muscles are gemellus superior, gemellus inferior, the piriformis, which is what everyone knows about because of the sciatic nerve, the obturator internus, obturator externus, as well as the quadratus femoris. So those muscles are originated in this area of the ilium, which is part of the pelvis, and that's where they originate, and then they attach to the femur, right? So where it's attached, so what happens is when it contracts, it actually turns your hip outwards. So those are very small muscles, but they're overlooked. So if you watched my quads video for the exercises, as well as the hamstring videos, I did talk about making sure that your knees and your feet, or your hips, knees, and feet are aligned. What tends to happen is because those muscles are weak in a lot of patients, you end up seeing this, where the knees turn in. So a lot of times people will stand with their feet pointed towards each other. That can cause, or is the cause, or the internal rotators being tight, or the weakness of the external rotators. So it doesn't have to happen with both legs at the same time. Sometimes it's more evident on one side. As you can see, if I'm not trying, my left knee wants to turn in, or my left thigh wants to turn in, and a lot of that is because my left external rotators are weak, so my thigh bone tends to turn in. I don't know if you can see that from the front view, but what I have to do is basically to actively try to rotate my femur outwards. Maybe you can tell the difference now as I do that. It's very important that these muscles are strong. So when you try to do a squat, what can happen is you don't realize that your knee is going in. Like I said, I always say activate your glutes. When you activate your glutes, then it'll help turn your thigh outwards, and it'll help correct with your alignment. Another thing is jumping. So when people tend to jump or land, they land this way, or going up and down the stairs. Oh, I happen to have my kid's stool here. So when people go up and down the stairs without realizing it, they do this, right? Or when they go down the stairs, they do this. So I like to talk about this muscle because if these muscles are weak, it tends to make the muscles in the inner thigh tight. You end up having knee issues, ankle issues, hip issues, back issues. It comes with a lot of symptoms. That's why it's important to strengthen these muscles. There are other things that come into play. Some people might end up making up for tightness in the ankles. So what tends to happen is that your foot will do this as you're trying to correct the compensation in this area. So be careful with that. I'm just going by one muscle group at the same time. Really, this is just for educational purposes. If there's any pain, if you're experiencing any pain, or if you notice that there's some instability or any other symptoms that's out of the ordinary for you when you try to perform any of the exercises that I give, make sure you consult your physical therapist and or your doctor regarding that in order to get a referral for a physical therapist. When these muscles are weak, it's evident when people walk. So I can almost always tell when people have weak hip external rotators. And also there are a lot of runners that tend to overlook the hip external rotators, and that becomes an injury down the road or an injury waiting to happen. Not just runners, but people in the gym, dancers, sports players, any sports. I like to watch people and how they move. So it's very, 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 very common to see people with weak hip external rotators. So stay tuned. I will be showing you some exercises to strengthen these muscles, these very important muscles. So if you have any questions, go ahead and leave a comment or send me a message or email me, and I'll try to address them in my next videos. Thank you.